Communicating with your Hispanic Patient by Amy Frazier. You walk into your Hispanic patient's room to hear him say, "No hablo inglés," and you speak very little Spanish. This challenge shouldn't put you into a state of panic or be an obstacle to communicating with the patient. This should not stop you from providing culturally competent care. Besides being fluent in Spanish, there are other ways to communicate effectively with your Hispanic patient. Culturally competent care is defined as a complex integration of knowledge, skills, and attitudes that allow healthcare providers to understand and to take care of people that are from cultures that are not of their own. There are several patient encounter tips to help you improve your communication with your Hispanic patient. Compassion and communication are essential ingredients for providing successful culturally competent care. The nurse-patient relationship is built through communication and the effective use of both verbal and nonverbal language. Both verbal and nonverbal communication can impact the experience of the Hispanic patient in a healthcare setting and may influence their care-seeking behaviors and adherence to treatment. Learn how to greet your patients in Spanish. Buenos dias for good morning or buenas tardes for good afternoon are simple enough and can be very effective. A few spoken words in Spanish are a great icebreaker and can help put the patient at ease. When speaking Spanish, always use the formal usted and not the informal tú as a sign of courtesy and respect. Try to avoid calling patients by their first name. Rather use señor, señora, or señorita for an unmarried woman. Take time to establish rapport with the patient. Avoid going directly into business. First, ask some warm-up questions about your patient's family or job. Small talk can take a few minutes, but it will work wonders in gaining someone's trust and respect. Showing sincere interest in your patient's life and using friendly body language will make your patient comfortable about sharing information. Feminismo is the value of family over individual or community needs and the expression of strong loyalty among family members. At a typical patient encounter, you're likely to find 1 to 3 family members with the patient. Make sure to greet and acknowledge everyone in the room, even the children. They will accept you as warm and compassionate. Welcome your patient and their family into the conversation. Health matters are a family decision for the Hispanic family. Hispanic patients may want to include family members in the discussion of treatment or care, so speak to both the patient and the family. However, you should first get permission from the patient to protect their confidentiality. Although maintaining eye contact can be a sign of respect in some cultures, it's seen as a challenge or intimidation to the Hispanic patient. Additionally, a patient's silence can mean many things, such as doubt, shyness, anger, politeness, or not understanding. The nurse can attempt to clarify with further explanation or with questions. During an examination, patients may feel uncomfortable being touched by a healthcare provider, as this contact is generally reserved for family members and close friends. A hug and a light kiss on a cheek are common between close friends and family. Whenever possible, use a professional interpreter instead of a family member. Sometimes there may be no choice. The interpreter is there purely as a communication tool. The interpreter should translate your messages in first person and speak directly to the patient. Do not relate to the interpreter, but rather relate to the patient. Ask only one question at a time and speak in short sentences. Wait for the interpreter to finish talking before you continue and use a normal tone of voice. Avoid using slang and technical medical terms. Do not allow the interpreter to respond to your questions without the patient answering your questions or replying to your comments. Encourage questions from your Hispanic families. In the Hispanic culture, doctors and nurses are often seen as authority figures, and it is not polite to question their knowledge. After you explain something to your patient, do not simply ask the question, "Do you understand?" Your patient may just nod. Instead, ask them to rephrase the information by saying, "Please explain to me what I've just told you," or in your own words, "Tell me what I said or what I'm asking you to do." Thank you.